So, welcome Dr. Khosrow Adeli. He is the head of clinical chemistry in Hospital of Sick Kids in Toronto and currently the IFCC president. So, welcome to Radio the Microscopio.
Thank you.
We wanted to know which are the strategies, the IFCC strategies for the next 3 years.
Definitely. Thank you for arranging this interview with El Microscopo, which I think it's a very valuable program developed by Hernan many years ago, and the IFCC has been always very supportive of this program. So I'm pleased to participate today. I will discuss the future strategic plans of IFCC. But first, I want to say that I'm really grateful to have been elected as the IFCC president, and I want to thank all the societies who participated in the election last year. I have received a lot of support from every corner of the world, and I really appreciate that. And it really helps me, encourages me to work hard to ensure that I don't disappoint the IFCC membership, and I hopefully be able to work with the executive board and task forces and committees to be able to make a difference in the next 3 years, to come up with a number of new programs to try to make IFCC much more active than it is currently. IFCC has been very successful, but I believe in a number of areas there is room for improvement and growth, and so I'm hoping to work with all of you to make this happen. I want to say that the key goal that I have over the next few years is to make IFCC have a more activist role. By activist role, I mean that it's more active on the ground in different regions of the world, helping to improve lab quality, to improve patient care, to contribute to education. And it shouldn't be spending most of its time discussing things within its own organization, but try to broaden its horizon to look at how we can make an impact. So a number of plans have been put together that actually try to hopefully achieve that goal, which is to make us much more active and much more sort of proactive on the ground, working with particularly developing countries to make change and improvements in a number of areas. So the areas that I've particularly focused on are the following. One of the key aims is to directly impact healthcare and patient outcomes. Now, how do we do that? How does IFCC make a direct impact? Well, I think it can do so by helping particularly developing countries establish programs that they don't currently have. And one example is the newborn screening. Newborn screening is a very important area because once a child is born, this is the best time to screen for genetic diseases. Now, many developed countries do that very well. For example, in Canada, we screen for 35 different genetic diseases after birth. Every child receives a screen. This is by mass spectrometry and by other immunoassays to try to assess whether genetic disease is present. And of course, if you can detect these conditions early, you can intervene and you can try to reduce complications of these genetic diseases. But if the children are not screened, this can lead to significant morbidity and mortality. And of course, it also increases healthcare costs in a sense that it makes makes it very expensive. Imagine a child who has significant disabilities and mental retardation and other problems because of lack of screening. And this child can become an adult and can be a major burden on the healthcare system. So a major intervention early during, right after birth is an important contribution. Now, many countries around the world do not screen at all. So there is no screening program in many developing countries. So one goal that we have is to establish programs in those countries, work with local societies to establish newborn screening. And so therefore we are forming a task force this summer. This task force will have experts in newborn screening, and they will start putting together terms of reference. And then we will start working with developing countries. We have already selected a few countries, and we like to actually contact everyone else and see who else is interested in to participate. But what we would like to do is this. IFCC will develop a program, will even fund the first year of the program, will provide potentially equipment, it will provide funding to get the first year of screening started, and then work with the local government and the society so that they continue this program over the following years. So we want to help them establish the program, but then the long-term funding eventually needs to come from the local government. So that's one program, but this is one of several areas where we can make a difference to patient care and healthcare in general. By the way, we like to collaborate with WHO as well as with the Gates Foundation, because they support programs in developing countries, and with industry, a number of industry partners who are involved in, let's say, mass spectrometry and other instrumentation that can be useful to newborn screening. So this will be done in collaboration with these various partners. So it is a very ambitious program, but I think it will be it will make it, even if we are successful with one country, we have succeeded. Now, but I hope that in the next 3 years, we'll be able to do this with at least 10, 20, 30 different countries, as many as we can. So that's one area. The second area that I think IFCC should be directly involved with is improving quality of lab testing and lab results, and through external quality assurance. Now, again, many developing countries have no EQA. They do not have external quality assurance. Some of them even have poor internal quality assurance. So the idea is that we are forming a task force, and this program will start an international EQA program under IFCC umbrella. So the IFCC will have an EQA program, and it will be provided free of charge to developing countries. Now, we have already discussed, we're going to have a company that will help us send samples to those countries, and we're going to start with a pilot program with 12 to 15 countries the first year, and then expand this to many other companies over the coming years. I should say countries over the next few years. So therefore, we're hoping to develop an IFCC EQA program and then make it freely available to developing countries. This already, have actually made some inroads already. We have selected a company, we have discussed it. We're going to have a call, by the way, for proposals to try to ask countries whether they are interested in participating. So this is, I feel is very valuable. My view is we shouldn't just tell people of high quality about quality. We should directly help them improve quality. So again, it's related to the being an activist and being involved directly rather than just preaching that quality is important, is helping them to develop a better quality. Another key area of our strategic plan is the e-learning or distance learning. But as you know, I think it's clear from, especially during this COVID-19 crisis, that distance learning is really important, is the way of the future. IFCC actually invested quite a bit in a program called the E-Academy, but unfortunately the program has not been very successful. So what we are trying to do now is start a new program with both live webinars, not just recorded webinars, live webinars on a monthly basis the first year, and I'm hoping in the second year will become a weekly webinar live throughout the year, where we have specialists across IFCC give lectures and then would be broadcast on a platform, and we're looking at some of the best platforms that IFCC can invest in a good platform that will deliver webinars. And we have actually found one that seems to work very well. So we're in negotiation right now. So there will be a platform for webinar development and delivery, and it will include live webinars as well as recorded webinars. The recorded webinars, so we'll have, let's say, one webinar that's live, followed by several recorded webinars that will be put on the E-Academy. So the idea is to significantly increase distance learning and e-learning. And this is particularly helpful to developing countries. So we have a lot of expertise. IFCC has more than 45,000 scientists around the world. We can potentially get many of these scientists give lectures and so make this international. So it won't be only lectures from developed countries, but have participation from all members. We have 93 different member countries. And we also, by the way, have 47 corporate members. So both the corporate members and the member countries have so many experts. And so we are actually rich with a lot of expertise, and a lot of these people can be giving webinars. This is going to be a much more effective than having physical meetings. Of course, we're going to have physical meetings, but the webinars would program, a much stronger webinar program, would allow us to deliver much more information every month, every year. So this is a major part of our strategic plan. And I'm hoping that the work in this program will coordinate with the Task Force in Young Scientists and the work done by Santiago and his team, because I think, for example, that group can use the same platform that we use for other webinars. So the idea is to come up with a single program that will help not just the young scientists, but will help the entire IFCC. The next area of a strategic plan is promoting lab medicine to the public, to governments. Actually, the COVID-19 situation is an excellent opportunity because it has clearly highlighted how important labs are to public health, to monitoring infections in this case. But also when patients go to the hospital and have to go to ICU, the number of lab tests that are done, biochemical testing, hematological testing, immunological testing, these are really important in care of these patients. So the COVID-19 situation has highlighted the importance of lab medicine to healthcare and to public health and patient care. Therefore, we would like to take this opportunity to do more PR, public relations, around lab medicine. But before we do that, we were forming a task force to do studies. What we lack is evidence. We go around and say 70%, 80% of healthcare is impacted by lab medicine or lab testing. But when you look at the evidence actually is not there, is not very clear. So we lack evidence. So the idea is that we will be doing with this, the task force will coordinate. And actually, I'd like to have countries from every region participate. So hospitals, let's say in South America, hospitals in North America, hospitals in Europe, Asia, Africa, everywhere, participate. The idea is to look at the specific areas of lab medicine and do outcome studies. So we're going to look at, for example, how cardiac markers are impacting care of cardiac patients. Of course, we talked about COVID-19 and of course the importance of infectious disease testing and also serology testing. But there is also the cardiac markers, there is renal markers, so we could do studies. So let's say a hospital in Argentina, a hospital in Canada, and a hospital in Europe can collaborate to look at cardiac markers and collect data on the importance of these markers to care of patients. For example, for cardiac failure, heart failure, NT-proBNP is a very good marker that's being used. Well, you could look at how many patients were benefited from the testing of NT-proBNP. This, of course, requires, it could be a retrospective study, but later, where you can go and check patient records, which could be done fairly quickly and simply. But there could be also prospective studies done for a 6-month or 1-year period. And all of this data could then be compared between different parts of the IFCC community, different regions of the world, and then published and also presented at different conferences that IFCC holds. So the idea is to do a lot of this kind of study in critical care. I mentioned cardiology, nephrology, GI and nutrition, and several other areas, infectious disease, and so on. So therefore, the idea is to do multiple studies in the specific fields of lab medicine, collect evidence, and then use the evidence to do public relations. So the idea is to do promotion with evidence, not just simply start preaching about how important the lab is, but to actually collect the evidence first. And I am hoping that this can be done in the next couple of years, at least some preliminary evidence. Now, this kind of work should go on for years, but at least we can collect some initial evidence that can help with public relations and promotion. The last item that I wanted to mention is the area of reference intervals. Well, as you know, I've been very interested in reference intervals myself, but this is not the only reason. The problem is we have many labs who are using reference intervals for children or for adults that are not up to date and they're not evidence-based. And there is a lot of variation. For example, in Italy and in Canada and in other countries, surveys have been done looking at what labs use, for example, for thyroid hormone reference intervals. What the result shows that even labs using the same reagent and same instrument are using different reference intervals. So this is a bit of a nightmare in a sense that different labs are interpreting results differently, even though they're using the same reagents and same instrument. There is no excuse for that. So clearly, there is a huge variation in test interpretation. I have always said quality of lab testing is not just the precision and accuracy, it's also reference interval. If you do not have an appropriate reference interval, when you do the testing, even if it's a really high quality lab, if you use the wrong reference, you are reporting the wrong, you're giving the wrong interpretation. So you got to have quality in the lab, but also appropriate, up-to-date, evidence-based reference intervals that would allow you to interpret the results accurately. And this is a major gap, both for children, for adults, and also for old people in the geriatric population. So the idea is that there will be a new task force that will create a global consortium of reference intervals. We will have an IFCC website that will have a database of reference intervals from around the world. We'll look at the evidence that currently exists and put this into a database online so that every lab around the world, when they're looking for a reference interval, they can go and find it on the website. And so IFCC can become the best source of reference intervals for children, for adults, and for geriatric population. And also for, different sexes, different ethnicities, because there are some differences among different ethnic groups. Therefore, all of this information could be put online. But also, this program needs to continue doing the studies. We actually have a committee on reference intervals and decision limits. So that committee is actually very, very active doing the studies. But as they do the studies, the data can go onto this website and this database. And also we could collect data from all regions of the world and put it on this website and this database. So I'm hoping to create a source of reference interval, a resource. This resource can then be used by labs around the world. And this could help with harmonization. The idea is to harmonize. So let's say if your lab and my lab are using the Roche Cobas assay for, let's say, TSH, that we should be using the same reference interval. There is no reason, unless you have done a study that shows that, let's say, people in Argentina have a different TSH level than people in other countries. If not, then we should be using the same reference interval. So that's why I think this is a major problem, actually. It's much bigger than people think it is. It's a huge concern. For example, in Italy, they did a survey of 400 labs, and they found that there were people using the same instrument had many, many different reference ranges, and nobody knew where these reference ranges are coming from. So the source of the data was unclear. So you could see that this is a major source of lab error and patient error, and therefore it needs to be addressed. And so IFCC can play a role by trying to harmonize and analyze the data that exists, as well as collect additional data. So those are the major points I wanted to mention. Those are the major goals. We have several other ideas, and I'm actually trying to hopefully collect more ideas from various members of the community. We are going to be publishing every month an article on the strategic plan in the IFCC e-news, the newsletter, and ask for the societies and scientists around the world to give us suggestions on some of these topics, but also perhaps other ideas that you may have. So therefore, this is the next 6 months will be a consultation phase where we're consulting with everyone around the IFCC before these programs start. So thank you very much. That's sort of a long summary, a long answer to your question, but happy to answer any other questions.
It was really clear, and what is very clear right now is how important communication is, right, between colleagues and around the world.
Exactly, certainly, and communication is everything. That's why actually I recommended, I have actually met with all committees and task forces and divisions, and I've recommended that we now use the Zoom web with video conferencing to have many meetings. So each committee, each task force will be having multiple meetings to increase communication, because communication is key. More communication means more productivity. And I'm hoping that that will be the way we operate the next few years. So actually already every committee, I don't know if you're aware, but since we started talking to everyone, this month, there have been at least 50 different Zoom meetings of different committees in IFCC. So we are trying to enhance communication and therefore enhance activity.
Khosrow, now we have a good opportunity to connect with the healthcare team with through the electronic health records. We have a very good connection with HL7 system to connect different systems with a database. It's a good opportunity to transfer our knowledge to the medical clinic, to transfer the good evidence to make the best decision, to improve the decisions making. I think we can do
I fully agree.
Team. It's a special team working in interoperability and connect this database with a specific question, not only with general question, but a specific question about one patient to give a specific answer. We are working in also in Savio system, which is a specific system to connect the knowledge with the source of the knowledge with the people who need this information in the specific moment.
Certainly, and actually, I really welcome your ideas and some of the skills your team have. Actually, yesterday we had the executive board meeting, and I mentioned that I really want to get Hernan and Agustina and Santiago involved in the bigger things we want to do, not just the niche programs, like not just the young scientists, but like the webinar program I mentioned, as well as, you know, development of databases that we like to do, maybe the outcome studies. So we definitely would like to have your, because you are one of the most active groups within IFCC, and I want to encourage that further.
Professor, thank you very much for your interview. It was very, very clear, your ideas, and I'm sure this will encourage a lot of young people and colleagues, laboratory medicine colleagues from all around the world to join to these initiatives that I am sure there will be a lot of success having you as leader in this case.
Thank you very much. And I hope that all of this can not be done just by a few people. This is going to require all of these plans, require participation from every one of you. So I look forward.
Thank you. Of course, you have all the support from the Young Scientists Task Force.
Thank you. Thank you. And thanks for this opportunity. So we'll talk again.
Thank you.
Bye.
Thank you very much.
Bye.
Bye-bye.
Bye.
Bye.